my name is Gadir and I'm one of the pharmacists working at the Courtyard Clinic, and this is part of the webinar series and it's the 12th one. So for the next 10 minutes I'll be talking about home delivery service we provide here at the Courtyard Clinic, and I'll go through 10 points. So the first point is, what is home delivery? It's basically delivery of medicines to patients, and it's an alternative method to receiving your medicines in basic terms. The delivery can't happen to the hospital, so it has to be either to your house or another alternative address. What does this mean? So first of all, it can be convenient for patients, which means when you come and see the doctor at clinic, you don't have to be waiting around, waiting for your medicines to collect from the pharmacy, and you've got the opportunity of getting the medicines delivered at several delivery options. What it means for the hospital, the clinic, it allows us to save 20% on VAT of the drug expenditure, and in return that will help with enabling us to treat more patients. Number 3, which home delivery company do we are signed up with? We are with Alcura, and they provide our home delivery service at the Courtyard Bush Clinic. However, there are other home delivery companies, but just to make you aware that there are other home care companies. However, it depends on which clinic you attend. So at the Courtyard Clinic we use Alcura. Number 4, delivery options. Which options do we have? So medicines can be delivered to your home or an alternative address. So for example, if you want to get delivered to your house, or you want to get it delivered to work or university, that option is available. It's convenient and the delivery is quite discreet, so a package will come with your name on it and will have no information about what's inside. Another option is Alcura also provide a community collection, and they have a relationship with Boots the Chemist, where you can get the medicines delivered to Boots that's nearest to your house, or whatever location is convenient for you. And then you'll just go in and present with a patient card, which will have just your hospital number, and then collect your medicines. One thing to bear in mind, the service is completely confidential, so they will not have any information about what's inside the package. So it's completely confidential. Point 5, what is the clinic process if you do want to sign up with the home delivery service? So you will see your doctor as normal, where he will write a home care prescription, and that's just an example of how it looks. Now it can vary from different clinics, but at the Courtyard this is the one we use. You will take the home care prescription to the Courtyard pharmacy, you'll drop that off, and then the home care company, then that will be processed and it'll go to the home care company, where then they'll get in touch with you either by a phone call or a text message to arrange delivery of the medicines. Now, the process when you drop your home care prescription to pharmacy to actually getting a phone call, it can take up to 2 to 4 weeks. And the reason why it takes 2 to 4 weeks, because depending on when you've had your bloods, we will check your recent blood results, and the pharmacist will do a clinical screen to make sure the medications are appropriate, and then we'll process the prescription to the home care company. So usually about, we say 2 to 4 weeks, and that's why it's really important to have a 1-month buffer supply when you sign up to the service. How or who can sign up for the home care service? If you are interested in getting your medicines delivered by this service, speak to your doctor or pharmacist next time you're at clinic. What we will do is we will identify whether you're eligible for the service. Usually if you're stable on treatment and you have a undetectable viral load, you can go on the service. If you are changing treatment, you might temporarily come off the service and then go back onto it once you're stable. Then one of the pharmacy team will help you complete a registration form. Once you've signed the registration form, then you can sign up, then you can have home delivery prescription. It's really important to have a registration form and consent to having the delivery option. Point 7, supply and buffers. We will ensure that you have enough supply until your next doctor's appointment. So when the prescription is written, if you have a 4-month follow-up or a 6-month follow-up, you will have enough supply until then. But it's really important you monitor your supply as well, especially if you're going away or you're traveling on holiday, or if you cancel your appointment, please ensure you have enough supply. Also, we will make sure you have a 1-month buffer supply, and that's given from the pharmacy in Courtyard. Communication is really key when you sign up to the service. If you change your delivery method, whether you want to deliver it to your house or an alternative address, or you want to get it from Boots Collection, please get in touch with the home care company and communicate that. Very, very important, if you do change your contact details, your address or your phone number, please get in touch with Alcura to inform them, or let us know when you hand in your prescription, because they will try to get through to you, and if you change your contact details, they'll find it very difficult to arrange delivery. Also, if you change clinic and you no longer want the service, please let us know, we can inform them as well. Point 9, contact details. In the Courtyard Pharmacy, we have details of Alcura, which have all the relevant numbers if you don't hear from them once you've signed up or you're waiting for a delivery. Also, you've got our Courtyard Pharmacy contact details and the home care team at St. George's, which will process your prescription contact details as well. And then finally, point 10, if you have any questions or would like more information about the service, please come speak to us at the Courtyard Clinic, and any of pharmacy staff would be able to help you or answer any questions. Thank you.